Good morning or afternoon, all of you MRHA listeners. We have another webinar happening right now with Dr. Sean-Luc Webster, PharmD. He's a Rural Health and Health Equity Research Fellow at the University of Maryland Eastern Shore School of Pharmacy and Health Professions. And he's been with us doing a rotation with the Maryland Rural Health Association for the past few months, looking at addressing food insecurities. Luke has a fantastic research presentation prepared for us today, and I will turn it over to Luke.
Thank you, Jonathan, for the introduction. So today we're going to be going over the concept of securing healthy diets and also promoting a lifestyle of health promotion. So the main focus of this presentation is going to be on food insecurity and what ways that can be done in order to address that. So here are the learning objectives that I have for this presentation. The main concepts that I want you to take away from it are defining what food insecurity is and also the factors that lead to it, and also to explain what the social determinants of health are and how they lead to the onset of food insecurity, and also to describe different cooking recipes that can be used that prepare nutrient-dense foods such as fruits and vegetables to help improve dietary quality. So to start off, we'll go into the background to define what food insecurity is. So basically what it is that it is a condition to where households lack the financial or social resources necessary to have consistent access to healthy meals. So food insecurity, when most people have the perception of food insecurity, they think of those to where they're experiencing chronic hunger, to where they're skipping meals or they're going without food for a period of weeks or months. But while that was a case years ago, particularly during the cases of the Great Depression, now food insecurity has become a little more complicated, to where you have food insecurity more or less on a continuum, to where there are specific degrees or severity of food insecurity. And one of the main concepts to understand is that food insecurity does not always lead to food deprivation, but there are cases to where it doesn't lead to malnutrition, but there are cases to where a household is food insecure, but their dietary quality suffers. So food insecurity is identified by the U.S. Department of Agriculture in two main classifications. So you have the low food insecurity, to where food intake is not reduced, but the dietary quality and variety of their food is poor. So, for example, think of a low-income household that consumes a variety of their meals from, let's say, a gas station or from a fast food area, a fast food restaurant. While they're still eating breakfast, lunch, and dinner like a normal household, because they have less fruit and vegetable access and less nutrient-dense food access, they are defined as low food insecurity. Then you have very low food insecurity, which is that traditional form of food insecurity, to where households have to make tough decisions on whether they have to pay whether they decide to pay their medical bills or to access food, or do they decide between keeping their electric on or eating food that day. So basically, that's where not only does dietary quality suffer, but also eating behavior suffers as well. And these are the most severe of food insecure patients that we try to do interventions on to address. Now, here is a table that's described by the U.S. Department of Agriculture. You have low food security and very low food security at the bottom. Then you have marginal food security, which just describes where households, they have consistent access to healthy foods, similar to a high food security household, but they have more anxiety than a higher food security household, such as where can they access the foods that they normally eat. So, for example, you could have some households, because of the increased cost of food prices, to where they're becoming more anxious because they have to cut their disposable income in other areas. So while they can consistently access those foods, they have increased degrees of anxiety over if these prices keep going up, what am I going to do to address these food security? So that's the main difference between marginal food security and high food security, which is where there is no access. There's no difficulties with accessing healthy food at all. So the causes of food insecurity is a complex, multifaceted problem. So there's no one problem that is contributing to food insecurity, but it's due to it's due to choices that a person makes, and also due to wide societal factors that decrease the access to healthy food. So being in a food desert, experiencing chronic unemployment, and also even things such as discrimination in the workplace for racial minorities, all of these factors can come together to contribute to the development of food insecurity, and it disproportionately impacts some populations over others. So this leads to a health equity issue where we at MRHA and also the University of Maryland Eastern Shore are trying to devise ways in order to address. So factors include income, such as lack of financial resources. The cost of housing can be a significant factor as well, because the higher the cost that a household devotes most of their income towards housing, they have to usually make cutbacks in other areas. That could be in either food, that could be in either certain entertainment venues that they would normally do. So they have to make compromises in certain areas. So as the more proportion of their income goes towards housing, they will end up having to cut back in certain areas of food consumption. And also structural integrity of home utilities. So basically what this means is a household can be living in a household that is dilapidated, so in a way to where they live in older homes, usually that they are over a period of 50 years old, and they can have issues with their utilities, such as their pipes burst or their circuit breakers go out. So basically disruptions in their electricity and also their home utilities can negatively impact whether or not they'll be able to store healthy food on site. So for example, if you have vegetables that are stored in a refrigerator, and if the power automatically goes out and you don't know when the power is going to come back on, if you don't have access to a generator, that can lead to that food end up spoiling, and that can motivate certain households to prioritize foods that have a longer shelf life. Think of your processed foods like your chips, your cookies, and your cakes. And while that does have the benefit of not requiring extensive refrigeration, it comes at the downside of poor health, because these are normally empty calories. And also chronic unemployment, depression, and just overall stress and fatigue, to where households are too tired or too stressed to be able to advocate towards eating healthy diets, such as through cooking and through other methods such as that. Also, the lack of presence of supermarkets is an issue with certain areas as well, particularly in remote areas. So in the state of West Virginia, there are several counties that are known as food deserts, which are defined as households that are more than a mile away from a grocery store if they're in an urban area, and more than 5 miles away if they're in a rural area. And in these cases, access to consistent transportation is absolutely necessary in order to ensure your food needs are met. And if one grocery store closes down, that can create a cascade effect that can create a food desert across an entire section of the state. And on Maryland Eastern Shore, there are food deserts in particular sections. And then you have certain towns and economic centers to where there are some patients that do not have access to reliable transportation, to where they will have to walk for extended periods of time in order to go to a gas station or go to a restaurant of some type in order to get access to a meal. And that can definitely reduce dietary quality, because if they have to spend that amount of time in order to access healthy food, then that will lead them potentially to lower the amount of times that they would eat during the day. So in case of having a healthy diet of eating like 2 or 3 times a day, they're eating only 1 time a day and not eating until the next day, which can increase risk of malnutrition and things of that nature. And also there's been increased attention in the literature that has been going on, that's been focusing on the ethnic disparities that have been observed in food insecurity. So it's been found in literature that certain minorities, such as Blacks and Hispanics, are at higher risk of having food insecurity compared to non-Hispanic whites, and also those from healthier socioeconomic backgrounds. So the food insecurity, from what I've seen in the literature and throughout the nation, is approximately 11%. but they found that Blacks and Hispanics have food insecurity rates of around 25% to 21%. So factors in the play could be due to the presence of concentrated poverty, because where you have some forms of social disadvantage, you tend to have other areas of social disadvantage as well. So where you have a Black or Hispanic population, they're more likely to live in a low income area, to where there's high levels of concentrated poverty. And usually where you have high levels of concentrated poverty, you have increased levels of crime and also increased levels of socioeconomic disadvantage. So other factors such as discrimination can play a role in there as well, but research is still ongoing into identifying the core causes of why food insecurity impacts some ethnic groups more than it does others. So this slide goes into detail about the importance of transportation in a rural area. So you can see this gentleman right here walking down a dirt road. And usually in remote rural areas, public transportation is not as widely available. So very often rural Americans, if they don't have access to a consistent car, or if they do have a car but it's broken down, they either will walk to another person's home or they'll end up hitchhiking to go to the nearest town in order to get a small bag of groceries. And while those bag of groceries can help them in the period of 1 to 2 days, inevitably that need of needing to get a ride to town, will end up needing to happen again. So while it is a short-term solution, it is a situation that requires long-term solutions in order to promote transportation in these food deserts. So that way, the most remote communities among Maryland's rural areas, as well as rural areas throughout the state, will be able to have access to the food security that they need. And one interesting pilot program that's being conducted in West Virginia right now is known as PharmAC. So it's farm as in farming, and AC, which is an allusion to pharmacy. So basically, what they are doing is that they are promoting providers providing prescriptions to certain food dietary regimens, such as apples or kale or broccoli. And basically what they are doing is that they are promoting the infrastructure towards having community gardens, so that way healthy food is within easier access, to where you don't have these situations to where rural residents have to travel 10, 20, or even 30 minutes away to get access to healthy meals, but instead they can have them within their own communities, and they give a prescription to one of the employees that is responsible for the program, and then they get up to $20 worth of produce. So it is a very interesting program, and what I would like to see is to have that program spread out throughout the state and have other states adopt it as well, and maybe to get the grant funding for that as well, because I feel like that can be beneficial to improving food insecurity throughout the U.S. So this goes into detail about the importance of transportation. So even if this can negatively impact those that even have a car, because what can end up happening is that when you use a car enough, it inevitably is going to get to a situation where it's going to break down. Either the starter goes out, or the fuel pump goes up, or there's something that will go up that will require that car not to be able to start and be able to be used properly. And when you live in an area to where you're not able to go to a mechanic within a reasonable amount of time, obviously you'll have your car in the shop for about a period of around 3 or 4 days. So that will leave a gap in what are you going to do in order to access food. Urban and suburban communities have more amenities to take advantage of situations such as this. So they have ride-share apps such as Uber or Lyft. You have buses that they can take advantage of, and even metros such as subways or other trains that they can go to any place in the city. Whereas in rural communities, they tend to have less options in terms of transportation infrastructure to take advantage of, particularly what I like to call transportation shocks that end up happening. So the only option for them is either just to walk or to have somebody give them a ride up there. And sometimes you have compassionate people that'll do that, and other times you don't. So it can be so it can lead to a situation where some residents do not have access to adequate transportation in order to reach areas to where they can purchase food. So it's important to emphasize that in a rural area, having consistent access to transportation is as important of a need as housing or a cell phone. So that is important to keep in mind. So this leads to the question: how do rural Americans get around these lack of transportation infrastructure and financial resources that you would otherwise have in, let's say, in an urban or suburban area? Well, what they do is that they take advantage of informal social networks. So informal social networks include such as affiliations with family members or friends or faith-based organizations. In my community, faith-based organizations play a significant role in organizing the community to address community-based needs. So they play a very key role in supplying the needs of a community, and also to promote those feelings of belonging and also overall happiness within a community. So they play a very important role there. And also just having regular positive relations with your neighbors, such as going over there, talking to them, introducing yourself, and also offering to help them out with any issues that they may have that they need help with. So in a rural area, you tend to do favors for others so you can get favors back in return. And this is what I like to call the informal rural economy, to where if you have done favors for one of your neighbors in the past, if that neighbor has skills that are useful to you, then that can promote collaboration, to where when you have an issue that needs to be resolved, and this creates a huge web of informal relationships, to where if you know somebody, they can get you in touch with somebody else who, let's say if your lawnmower breaks down, if you know somebody, you can call them up and say, hey, do you know anybody that can work on my lawnmower? Because there's not always places where you can just drive it and carry it to a shop within a reasonable distance. And so they can say, well, I know Joe who can work on lawnmowers, and he can literally come over and just work on it. And the amount that family would have to pay to get that lawnmower fixed would be substantially cheaper than carrying it to a more formal, recognized shop. So there are benefits with having these social networks widely available, and it helps promote collaboration and overall community cohesion. So inconsistent work schedules can also negatively impact food security as well. So you have some patients, that work at odd hours. So they can work either at evening shifts, such as graveyard shifts from either 4 to 12 or 12 to 8. So they're not always available within the evening time in order to have access to health, to be able to buy healthy meals and prepare them. And one thing about those that work night shifts is that when the daytime comes around, because the body is not conditioned to work for hours upon hours within the evening, they tend to be very tired throughout the entire day. And what that ends up happening is that they sleep and they take naps for several hours at a time, and that can lead to disruption in their dietary habits. And also you have certain occupations, particularly one of the main ones I can think of off the top of my head is those that work in EMS or work as paramedics, because they have to stay in their ambulances and be on call and they have to be able to arrive on scene within a certain amount of time. Very often they'll have to stay in their cars for hours at a time. So I've heard some paramedics where they'll actually make a full course meal throughout a day just based off of gas station food. And while that does solve the short-term issue of making sure you have enough to eat throughout the day and still be available on call, that can lead to a reduction in poor dietary quality. So based on demands of certain work schedules, it can lead to poor dietary quality as well. And also crime can impact dietary quality as well, to where research that I found shows that for every 1% increase in food insecurity, there tends to be a 14 increase in violent crime at the county level. So what can potentially be contributing to this is that when you live in a community to where you have gun violence or property crimes that are occurring. It can make people tend to hunker down in their particular homes or particular places of where they live. So they may be more afraid to venture out and find the other areas where they can afford food, and instead they just tend to go to the one store that they know down the street as quickly as they can and then come back. So, and if this can happen over a long period of time, that can lead to pretty much a climate of fear within a community to where you hardly ever see anyone outside, and if you do, they're just making a beeline to one store as quick as they can and then coming back. Substance abuse can play an issue in food insecurity as well, because when substance abuse progresses to a point where those that are affected have a great deal of dependence, to where if they do not take that substance, they become very sick without it, it can create an issue to where their brain or their mind is only preoccupied with acquiring more drugs. And what can end up happening is that they neglect their other needs, such as paying their bills, committing family obligations, and also to even accessing food. So you see so I know some situations where you have alcoholics, particularly those that are severe alcoholics, foregoing eating a healthy diet and allocating most of their money on getting alcohol, and that can lead to poor dietary health and also chronic illnesses down the road. Now, this slide goes into how the COVID-19 pandemic impacted food insecurity. So this was an unprecedented time that led to a situation to where Americans that have never experienced food insecurity before were more likely to became food insecure overnight. And also business closures led to increased unemployment that led those to where they were normally able to afford healthy foods to suddenly have that form of income either severely reduced or gone in the form of layoffs. This can disproportionately impacts essential workers, because these essential workers were not able to benefit from the remote learning, because their jobs, either if they were grocery store workers or if they were police officers, they had to be on site and on scene in order to do that particular job. And not only did that the economic factor lead to poor food insecurity, but it also increased the risk of COVID exposure and also COVID morbidity and mortality. And in that time, food acquisition became more difficult due to two main factors. You had supply chain issues, to where it was difficult to get access for pretty much anything. And also it became more difficult due to changes in consumer spending. I remember in the early stages of the pandemic, it was very difficult to find any form of toilet paper whatsoever, because every time that the toilet paper was stocked on the shelves, they were literally bought in bulk by a small group of people. And you have more hoard buying and panic buying, which exacerbated issues of having access to supplies even more. Now, here is a slide that goes over the social determinants of health. What this demonstrates is that our food security is influenced by a variety of different factors. It's influenced by our economic stability, which influences our financial resources, the neighborhood and physical environment, which influences whether or not a patient lives in a food desert or not, and also even education, such as how literate is the person to be able to read things such as food labels, or being able to navigate a grocery store, or have the training that they need in order to acquire financial resources in order to access food to begin with. So these list all the different factors that can impact health and well-being and influence a variety of different health outcomes, such as life expectancy and premature morbidity and mortality. So here are a list of questions. So I'll give you a few seconds to answer all these. So the first question is, which of the following best describes food insecurity? So I'll give you guys about 20 seconds just to review it and answer that. And then we'll move on to the other questions. Okay, the correct answer to this one is C. Next question is, what are the major challenges that affect food insecurity in rural areas? Correct answer for this one is D. And the third one is, why are informal social networks important for rural communities? Correct answer for that one is A. And the last one is, describe the relationship between food insecurity and substance abuse. Correct answer for that one is C. And this is a open-ended question. So the main goal that I have with this question is just to help promote thinking about the social determinants of health. How do you think, based on your experiences, how the social determinants of health play a role in food acquisition and being able to maintain consistent access to food? Like, what factors in your personal life, or those that you've experienced among the clients that you work with, or those within your community, what adverse social conditions do they experience that can negatively impact their ability to access food? So that's just an important thing to keep in mind. Now, this slide goes into the healthy dietary guidelines. So basically, for healthy dietary choices, they are a core component to ensuring good health throughout the lifespan. Eating a healthy diet is important for prevention of chronic diseases and also minimizing the severity of chronic diseases down the road. So it influences whether they develop, their age of onset, and also how severe it becomes. Factors such as childhood obesity can increase the risk of developing hypertension and dyslipidemia, let's say at the age of 15 instead of the age of 30 or 40. So it's tragic to have chronic illnesses develop at that younger age, because that can lead to an entire lifetime of dealing with things that a young adult would normally not have to deal with, such as having to take a prescription drug consistently, or having to experience complications of obesity, such as things like early MIs or heart attacks or early strokes. So it is very important to address these issues in their early stages as a form of secondary prevention, so that way you prevent them from getting progressively worse over time. So it's important to emphasize with healthy dietary changes is that they should be sustainable and adhered to over a person's lifetime. So eating a healthy diet is not a situation to where you change your diet for a period of a couple of days or a week and then that's the end of it. It avoids the use of fad or yo-yo dieting, which can promote weight loss in the short term, but what can end up happening is that can lead to all that weight that has been lost to be gained back, and also even more weight to be gained over time. And also it should be done to promote optimal health, and also to be aware of certain cultural or social preferences. So it's important for the diets to not be overly rigid, but can be easily modified in order to account for someone's cultural background and also for their personal preferences. So examples of illnesses that can be negatively impacted by diet include cardiovascular disease, such as development of heart attacks or strokes. Non-alcoholic fatty liver disease, it can be an issue with that as well. Hypertension and tooth decay, and also osteoporosis can be an issue with that as well, to where if you have decreased access to sources of calcium and also sources of vitamin D, because we're inside the house, inside buildings more now, so we're not able to get vitamin D from the sun as much anymore. It's important to get access to vitamin D from dietary sources, and over time that can lead to increase the risk of osteoporosis. So this goes into what is a dietary pattern. So every person that exists has a dietary pattern of some type. It is the dietary choices that a person makes every single day, and what foods that they gravitate towards on a daily basis. So when you get up in the morning, what do you typically go for to get something at breakfast? Or in the evening time, what food do you prepare, or where do you go to get access to that food? So this represents the overall habits that you developed over time, and those habits are shaped by culture. They're also shaped by socioeconomic status or your access to resources in order to gather certain foods, and also personal tastes and preferences, because everybody has things that they like and things that they don't like when it comes to the food that they eat. And the resources that I gathered for this were the 2020 to 2025 dietary guidelines. So examples of healthy eating behaviors include eating a variety of healthy fruits and vegetables, such as 3 or more servings a day, limiting the amount of drinks that have added sugar, such as sodas, sweet teas, or sweetened coffees. Sweetened coffees is a particularly big one, because I see a lot of people, they go to places like Starbucks, they go to places like Dunkin', and they get these coffees that are essentially more or less just glorified milkshakes, to where they get these lattes with all this milk and all this cream and also all this sugar in it. And at that point, yes, you're getting coffee and caffeine, but you're also getting a load of unnecessary, unrefined carbohydrates and high volumes of sugar that can promote the risk of obesity as well. And also using vegetable oils such as olive oils or avocado oils, and avoiding unhealthy fats for cooking, such as butter or margarine, can be helpful as well. And also limiting intake of sodium from all sources to less than 2,300 milligrams per day. The average American usually eats around 4,000 milligrams, last I checked, of sodium per day. So that can lead to risks such as fluid retention for those that are at risk of peripheral edema, such as those that are chronic kidney disease patients, and also those that are normally healthy. It can increase the risk of hypertension, which can increase the risk of stroke over time. Other unhealthy eating habits include consuming excessive amounts of junk. Also, stress eating can be a problem as well, and also eating while watching TV and consuming too much caffeine. So here are the dietary guidelines for Americans that are referenced by the 2020 to 2025 guidelines. It emphasizes following a healthy dietary pattern at every life stage. So it emphasizes to promote healthy eating towards children, because a lot of our dietary patterns are influenced by what we ate when we were kids. So basically, by having a healthy dietary pattern as early as possible, it helps prevent an issue to where somebody grows accustomed to eating something unhealthy, and then they have to make drastic changes later, which can negatively impact the adherence to a new dietary plan. Also, customizing and enjoying nutrient-dense foods that also take into account cultural traditions and budgetary considerations is important. But that can be progressively more challenging, especially with the cost of groceries progressively going up, what it seems like month by month. So sometimes that can be an issue as well. Focus on meeting food group needs with nutrient-dense foods, and also limiting beverages while also staying within calorie limits. Every person has different calorie limits that they need. You have some patients that require 2,500 calories a day. Another person may require 2,000, or another person require 1,800. It really is more or less how their body is wired and how their body is conditioned. So everybody has different calorie needs. And also limit foods and beverages high in added sugars, and also limit alcoholic beverages. Those are the core main components of improving dietary quality for Americans. Now, I want to go into detail about emotional eating or stress eating, because this is a issue that I have seen among some members in my community, and also some patients that I've worked with. So basically, we tend to gravitate towards specific foods, not because to meet a hunger need, but because it makes us feel good or makes us feel comfortable. So if you think of comfort food, such as mac and cheese or cakes, things that we associate with good times. So in a period of significant stress or a life situation to where somebody feels really sad, they can be more likely to gravitate towards those foods to assuage or dull those negative feelings that they have. And while this can help cope with their emotions in the short term, in the long term, it can lead to issues to where it can set up a cycle to where they eat excessively, and then that can cause their weight to increase. Now, this goes into the emotional eating cycle, to where something happens that upsets a person, and then they eat much more than they should, and then they feel an overwhelming urge or craving to eat. So it's a craving that can be so strong to where they just feel compelled to eat it, similar to what you would see with somebody that is addicted to drugs in some cases, to where they feel an overwhelming urge to eat like ice cream or eat cakes or cookies, and then afterward they feel guilty or bad, and then the cycle starts all over again. So the main core treatment for this is to identify the triggers that lead to emotional overeating and replace it with other healthier alternatives. So, such as like talking with a close friend, going for a walk, or practicing deep breathing to help improve anxiety symptoms. And also, if someone eats more than they should because they're bored, they can start a new hobby. They can read a book or go for a walk or do something overall that they enjoy. So that way that gets their mind off of the fact that they are bored, so they don't eat more than they should. So here's a discussion of why it can be. So this is another question that I would like to pose to the audience. Why can it be so difficult to change unhealthy dietary habits? Like what in your particular life, or for those that you work with or those that you communicate with, what can be difficult to change unhealthy dietary habits? So that's something to keep in mind. Now, here are a group of healthy cooking recipes that I found. So these recipes tend to be low in calories, and also tend to focus on adding fruits and vegetables into those dishes. So this is an overview of how to read food labels. You would be surprised at some people that do not understand how to read food labels, because it can be confusing for some people to be able to do, especially those that have not been exposed to nutrition facts labels, to where they'll just eat something and they'll just ignore the label. I'm guilty of doing that myself sometimes, but I just want to go into the core fundamental components of a nutrition label. So at the top, you have the serving size. So one of the main sources of confusion that I've seen, to where some patients misidentify the difference between the serving size and the serving per container, to where they'll look at the calories for 280 and they'll say, oh, if I eat this entire Hostess cake, I only have 280 calories. But they ignore the fact that there is 4 servings in the container. So you would have to multiply that 280 by 4, and that would be the real calories that they are consuming. So that's something that people underestimate. So they are underestimating how many calories that they end up eating. Then you look into factors such as how much added sugar there is in here, the added sodium, and also it's all based on a percent daily value. Now this is based on a normal caloric intake of 2,000 calories, and this can be confusing in itself, because as I alluded to earlier, there are different calorie intakes that different people need to have. So these percent daily values may not apply to every single person. And then you have the micronutrients here, such as vitamin D, calcium, and iron, and potassium. So for those that are doing dietary interventions, I would recommend testing people's knowledge on nutrition facts and labels, because if patients are able to read food labels and be able to understand the main information that they need to gather from that can help improve their dietary quality as well. So here is a recipe that I found here for salmon cakes. The main focus that I wanted for these recipes that I found is that I wanted them to be relatively simple, to where they take at the most around 20 or 25 minutes to prepare. So those are the instructions there, and also the nutrition facts here on the side. So there's 350 calories per 4 cakes, which is pretty good. Here's another recipe here that goes with chicken cutlets and sun-dried tomato sauce. And it goes into all of the instructions on how to prepare these meals. Now, I got these meals from a healthy website, but you can just go online and just type in simple meals to add fruit that you can add fruit for fruits and vegetables, or that quick healthy meals, healthy meals for losing weight or improving blood pressure. Another good source that I found is known as the DASH diet, or the diet to reduce hypertension. So you can look at those and also you can look at sources such as My Plate too in order to help improve dietary choice as well. So I will go over these all for the sake of time. So these are all just the different recipes that are there. And there's nutrition facts for those. And I wanted to emphasize the healthy oil example. So there are some oils that can be used for cooking that some are more healthier than others. So olive oils, you can have those omega-3 fatty acids in them that can be helpful, and avocado and coconut oil can be beneficial as well. These can be good, effective alternatives to, let's say, such as lard or butter, which are used to cook. Now, I'm not saying that you don't have to completely abstain from using butter or lard, because sometimes it tastes really good on eggs or bacon. But what I'm saying is that to use it in moderation and to use it sparingly, so that way you minimize the negative health impact that those oils have on your diet over time. So here is an exercise here that you can do on your own. These are different nutrition facts of different food items that I found. The main thing here that I wanted to address is where do you find the serving size, the serving per container, where do you find the calories, and also find out how much fat or how much carbohydrates are in each one, and compare one over the other in terms of what are the pros and what are the cons with eating this particular food item, and which one could be more healthy potentially over the other. So I'm going to go into detail on drug-food interactions. So in certain health food insecurity interventions, many of those that I've talked to, especially in my community pharmacy background, where they are completely unaware about how food can interact with certain drugs. And while in a counseling session, we emphasize how certain drugs interact with food, such as take with food and things of that nature, sometimes there's not always time to go into detailed explanations about how certain drugs interact with food. So I wanted to go into detail about how certain foods interact with certain drugs. So it's important to take into account how certain food products can affect certain medical treatments. And this is an important factor because estimated 260 million Americans use over-the-counter medications, and almost 50% of the population uses a prescription medication of some kind. And while a good proportion of prescription medications can be taken with or without food, there are certain medical regimens to where whether you take them with or without food, it is an important factor. It can influence how effective that medication works or how sick that a patient can feel from it. And as new treatments are introduced, it's important for a patient to review dietary choices with their providers and also their pharmacists, so that way they can identify any drug-food interactions that can be present, that can be very uncomfortable for the patient and also can be dangerous in some cases. So common factors affect the efficacy of drug regimens. Generally, the older a patient gets, the more a certain dose of a drug affects them over time, because as a patient gets older, their kidney function declines and their liver function declines to where a drug stays in their body for much longer. So that can increase the risk of having more drug in your blood than normally is healthy, and can increase the risk of toxicity and also adverse reactions. Certain malabsorption issues, such as gastrointestinal diseases, such as ulcerative colitis or Crohn's disease, can negatively impact how certain drugs are affected. And also, certain vitamin and herbal supplements can impact how drugs are absorbed as well. So that's why a lot of pharmacists ask, are you using grapefruit juice or are you using St. John's wort? Because these these herbal supplements can impact how certain drugs are metabolized. So there are two main mechanisms of how drugs affect the body. So you have pharmacokinetics and you have pharmacodynamics. So the pharmacodynamics is the effect of the drug itself, or how the drug works on the body. Most drugs work through blocking a particular biochemical pathway. So they bind to what is known as a receptor. So it's more or less like a lock and key, to where you have a key and you have the key, it will lock in, and the drug will come in and block the key's access in order to get to that lock. So so ACE inhibitors work that way. The statins work that way as well, and these are the main ways how they work on the body. And then you have the pharmacokinetic pathway, which is how does a body process a drug. So this impacts things such as how the drug is absorbed, how it's distributed to the body, and also its metabolism and excretion. And this is where the liver and the kidneys come in. The liver helps metabolize certain drugs, and the kidneys help excrete the drug out of the body. Normally, it's excreted through urine. Drugs can also be excreted through feces as well, but the urine is the main pathway of how drugs are eliminated. And the main goal is that they take this drug and they convert it to less active metabolites that are more water soluble. And as the more water soluble those metabolites are, the more easy it is for the kidney to excrete it. So here's one pathway that is important in pharmacy practice, it's the interaction between warfarin and vitamin K. For those that don't know, warfarin is a blood thinner that's been used for a very long time, and it's used for those that have a history of clotting, such as pulmonary embolisms or deep vein thromboses. And what it does is that it affects the vitamin K pathway. So this is a guideline here to where warfarin blocks this enzyme called Bacor. So what that does is that it helps prevent the activation of vitamin K. Vitamin K is needed to promote the activation of certain clotting factors, such as clotting factors 2, clotting factors 7, and 9. So when the body goes through a clot, there are different factors that work together as chemical mediators to help promote that clot. And by interacting with vitamin K, it's the warfarin negatively impacts these clotting factors from doing their job properly. And what can end up happening is the patient is eating much more vitamin K than they normally should. This vitamin K can outcompete the warfarin for that enzyme site, or that Bacor site. And with more vitamin K, the drug does not work as effectively, and it can lead to increased clotting. So that's why why many providers and pharmacists, what we do when a patient is on warfarin, we check INR levels periodically over a period of time, because that determines the efficacy of how the drug is working. Is the patient more prone to bleeding if the INR is higher, or if they more prone to clot if the INR is lower? So basically, they go into questions such as, what type of foods are you eating? Are you taking vitamin K supplements? And it's important to emphasize that patients do not need to stop taking vitamin K just because they are on warfarin. But it's important not to make drastic changes in their diet, or significantly reducing vitamin K or increasing vitamin K without informing their provider, so that way the doses of the warfarin can be adjusted. So sources of vitamin K include collard greens, broccoli, cabbage, mainly your leafy green vegetables, but they can also occur through supplements as well. So antibiotics can be affected by foods as well. So tetracyclines and fluoroquinolones are certain types of antibiotics that are used to treat certain infections, and their absorption can be impacted by certain minerals, mainly with iron and calcium. So what these can do is that they can bind to these antibiotics and make a type of combination known as a complex, and that can negatively impact the drug from being absorbed and getting into the blood. And naturally, you don't want that happening when you have an infection that needs to be cleared up. So that's why whenever I give counseling to patients, if they're on tetracyclines or a certain type of antibiotic that can interact with certain minerals, I recommend for them to avoid taking iron or calcium supplements either 2 hours before the medication or 2 hours after. This case, this is where fat and antiretroviral therapies can interact as well. a light meal with an antiretroviral therapy can increase the absorption of that medication by 50 to 70%. So that's why it's recommended that when a patient is taking an antiretroviral therapy, either to treat HIV or used to treat hepatitis, that they take it with a light meal in order to ensure that the drug works effectively. Now, here is a food that interacts with mostly so many drugs that can be prescribed to patients. So grapefruit juice or grapefruits themselves is a very important food to consider when drug regimens are concerned, because it interacts with it. It inhibits the function of an enzyme known as cytochrome 3A4. And this drug is responsible for metabolizing many different types of drugs. So if this grapefruit inhibits that enzyme, it can increase the plasma level or the blood levels of those drugs substantially and increase risk of toxicity and also severe side effects. So drugs that are affected by grapefruit juice include cholesterol medications such as your statins, your calcium channel blockers. Warfarin can be impacted as well, and also your antiplatelet agents. These are also a different type of agents that are used to help prevent clotting, such as clopidogrel and ticagrelor, and also immune system modulators can be negatively impacted as well, such as cyclosporin, tacrolimus. These are drugs that are used for immunosuppression during transplants, and they also can be used during certain autoimmune conditions, if I remember correctly, and also certain anti-cancer drugs can be impacted by grapefruit juice as well. Also, potassium supplements, if you're eating foods that have high amounts of potassium in them, that can negatively impact health as well. Potassium is one of those minerals that is important to keep within a normal range because it's responsible for different functioning of the body, such as the heart, the kidneys, and the muscles. And certain illnesses such as diarrhea and certain diuretics can lower the potassium to where if the potassium gets too low, it can lead to sudden cardiac death. So those patients can be on potassium supplementation, but if their diets are changed to where they eat more vegetables or more leafy greens, that can cause the potassium to go up higher in the other direction. So it's important to inform your doctor if you have an increase in consumption of potassium-rich foods if you're on potassium supplementation. Now, with most patients that have normal kidney function, the potassium usually stays within a recommended range. But if you have certain patients that have kidney issues, their potassium is more likely to be on the higher range. So it's important that's in a case where diet becomes more important to consider. Also, alcohol with nervous system depressants can interact with many different types of drugs that impact your cognitive functioning or your nervous system in order to work like it normally would. So examples include diphenhydramine, which is over-the-counter Benadryl. The reason why that helps you sleep is because it passes an area known as the blood-brain barrier. So it crosses that area into the brain and blocks certain histamine receptors, and it helps promote sleep. While it's not recommended to be used as a sleep aid, it's still used as a sleep aid a lot because it can be used as an effective alternative to sleeping pills. So it's important to abstain from alcohol. It can lead to situations where somebody feels dizzy or feels woozy, or it can lead to a situation where if somebody is taking a narcotic painkillers such as opioids, where if they combine them with alcohol, it can increase risk of where the patient will stop breathing and they can die. So it's important that these drugs alcohol is abstained when these medications are used. So to bring everything together, ensuring proper nutrients from plant-based sources is important to keeping a healthy weight and also promoting a healthy lifestyle and also minimizing the risk of chronic disease over time. So eating a healthy diet is important from ensuring prevention to where the body has adequate nutrients and adequate minerals that it needs in order to function properly, and also to promote optimal health throughout the lifespan. So our unique social determinants of health can influence how easy or difficult it is to access foods, and eating more fruits and vegetables based on the recipes that I described It doesn't have to be bland, or it doesn't have to be a miserable experience, but with different recipes and different spices that can be used, eating fruits and vegetables can actually be palatable and be enjoyable. But the main thing I would recommend is, if you're used to eating really unhealthy foods, is just to gradually taper them off, because if you do it cold turkey, it's hard to eat these foods that have more subtle flavors. And because certain foods interact with drug regimens, it's important to keep providers informed of any dietary changes, so that way if drugs need to be discontinued or doses need to be changed, they can be done so. And here are the references that I consulted for this presentation. So thank you all for listening in, and I hope that this presentation was helpful to you, either for your personal diet or for any food insecurity projects that you have planned in the future. So thank you all.
Thank you, Luke, so much for giving us a great overview of food insecurities. That was a very robust presentation that our membership can definitely utilize, whether it is for yourself or is for something that you would like to share with individuals within your own communities. All this information will be available on our website here within the coming weeks. And again, we thank Luke for your time here with the Maryland Rural Health Association.
Yep. Thank you, Jonathan.